Good evening, Sir Dino. Let's now listen to lung yin deficiency, where tongue diagnosis made easy.
Good evening, Doc. Good evening po sa lahat. Now we go to the lung yin deficiency. The tongue signs and associated with lung yin deficiency. Lung yin deficiency can develop during the course of an illness or depending on individual's constitution from kidney yin deficiency. This chapter focuses on the early and later stages of lung yin deficiency that develops independently of kidney yin deficiency. An important causative factor of an isolated lung yin deficiency is smoking. Over the long term, smoking generates heat in the lungs, which gradually leads to a clumping of lung fluids. The pathology is characterized by smoker's cough, which typically occurs in the morning and causes the expectoration of thick, discolored phlegm. Many years of smoking led to a dry or irritating cough, a result of a phlegm drying up. The heat in the lung shows itself in the anterior third of the tongue, which will be red. In the case of a more advanced stage of injury to the lung yin, this area of the tongue will present with small, thin cracks. In such cases, the color of the tongue body is very often reddish or red. Years of working in dry, dusty conditions can also cause lung yin deficiency. Bakers and miners, for instance, often suffer from this condition. The lung yin can also be injured by external dryness, either from extremely dry weather or central heating and air conditioning. Dryness in the lung manifests as a dry cough and dry throat or mouth. When lung yin deficiency has manifested additional symptoms such as hoarseness, itchiness of the throat, occasional blood-tinged sputum, and a feeling of heat in the body or of subfebrile temperatures in the afternoon will also appear. Dryness in the lungs is reflected in a dry tongue. An intense red coloration of the tongue body will only appear when there is both lung and kidney yin deficiency. So here is an example of tongue picture. Teachers, singers, and actors frequently suffer from lung qi or yin deficiency. Overuse of the voice may lead to a weakening of the gathering qi, yung song qi. This energy controls the strength of the voice and influences speech as it supports the qi of the heart and lungs. Early signs of gathering of qi deficiency are a depression in the anterior third of the tongue and a pale tongue body. Such individuals may also have a tendency to catch colds or have trouble with their voice. Deficiency of the gathering qi is often accompanied by symptoms indicating heart and lung qi deficiency. Occasionally, these tongue signs appear in people who suffer from long-standing sadness and grief. Sadness disperses lung qi and weakens heart qi. If sadness and grief remain unresolved for many years, the lung qi deficiency may evolve into lung yin deficiency. Okay? So here is another tongue picture of a lung yin deficiency. Tongue body that is red with many small cracks and with a depression in its anterior third may indicate the onset of lung yin deficiency. Patients who suffer from stomach yin deficiency will also often show signs of lung yin deficiency. If the fluids in the stomach are injured or exhausted, the yin of the lungs will be undernourished. Stomach yin deficiency may lead to lung yin deficiency is reflected in a vertical crack along the midline of the tongue and small cracks over the anterior third of the tongue. Frequent illness caused by wind heat, which often manifests in sore throat or loud barking cough, can also lead to lung yin deficiency. persistent long-lasting cough can injure the lung qi, which will eventually affect lung yin. In the case of feverish illness, when heat has entered the qi level and lingers in the lungs and stomach, the anterior third of the tongue will have red points. These reflect either the presence of toxic heat or heat in the lungs. An illness of this nature can also produce lung yin deficiency, as the heat will injure the fluids in the stomach and lungs. Specific tongue signs indicating lung yin deficiency will be evident. Okay, so here's another tongue picture. Okay, we go to a case of a male 32 years old. The tongue is pale red, swollen with teeth marks. Okay, so there is a presence of spleen qi deficiency, accumulation of dampness. There is also a depression in the anterior third. Okay, so there is a deficiency of gathering qi and lung qi. Symptoms of the patient is runny nose, sneezing fits, tightness of the chest, cough, tendency to catch cold. So Western diagnosis, there is allergic rhinitis, family history of allergies, overuse of voice as an opera singer, overworking, and irregular eating habits. Next case is a female 56 years old. The tongue is pale with slight teeth marks. So there is a spleen qi deficiency with blood deficiency. There is also a depression in the anterior third. So there is a deficiency of gathering qi and lung qi. Slight reddening of the teeth. So there is a slight heat in the heart. Yellow thin greasy coating. So it indicates slight accumulation of damp heat in the lower burner. Symptoms of the patient is dry cough, dry throat, tendency to catch cold, constipation, insomnia, and exhaustion. There's a prolapse of the uterus for the Western diagnosis, and background to disease, overwork, lack of sleep. Next case is a female 31 years old. The tongue is pale with slight teeth marks. So there's a presence of spleen qi deficiency and blood deficiency. Vertical crack in the anterior third. So there is an onset of lung yin deficiency. There's also red points at the tip. So there is heat in the upper burner, and there's a white greasy coating. So meaning there is a food stagnation. Patient symptoms, there is dry mouth at night, dry skin, constipation, bloated abdomen. Sa Western diagnosis, there is none. And sa background to disease, long-lasting pertussis 1 year ago, overwork, and smoking. Case history, Mrs. S, 31 years old, worked as a journalist. A year ago, she contracted pertussis. She did not react well to conventional treatment and suffered for weeks with coughing fits. She continued to smoke during the illness. However, since then, her skin felt very dry and she was very constipated with dry stools. She also complained about a severely bloated abdomen. The tongue body was pale and showed a crack in its anterior portion, and the pulse was noticeably choppy. Sa analysis, Mrs. S was very healthy until she contracted pertussis. This is reflected in the normal tongue shape. The pale tongue and choppy pulse indicate blood deficiency. The white greasy tongue coating points to food stagnation caused by hectic eating habits at work. The food stagnation disrupted the downward moving action of stomach qi, which caused abdominal distension. The constipation was due to a lack of blood to moisten the intestine as well as the lack of descending stomach qi. The vertical crack in the anterior third of the tongue is associated with the pertussis and the persistent coughing fits, what injured the lung yin. The patient's continued smoking gave rise to heat in the lungs, which was additional contributing factor. In Mrs. S. lung yin deficiency, manifested as dryness, that is dry mouth, skin, and stools. So we have here another case of a male, 65 years old. The tongue is reddish with curled up edges. So this indicates that there is a liver qi constraint, slight spleen qi deficiency. There's also a vertical crack in the anterior third. So there is a lung and heart yin deficiency. There is a yellow, thick, dry coating, accumulation of damp heat in the lower burner. Patient symptom is pressure and fullness in the chest. There's shortness of breath upon exertion. There's intense thirst, pain during urination, and there's back and abdominal pain. So Western diagnosis, patient has coronary heart disease, kidney stone, and type 2 diabetes. Sa background to disease, smoking for 35 years, and heavy physical labor. Next patient is a male, 41 years old. The tongue is reddish, slightly thin. So there's a slight blood in yin deficiency. Also, there is a curled up slightly, red edges. So there's a liver qi constraint with heat in the liver. There's also cracks in the anterior third. So there's a lung yin deficiency with heat in the lungs. There's also a yellow thin greasy coating. So there's slight accumulation of damp heat in the lower burner. Patient symptoms is dry cough, pain in the chest, stomach pain, difficulty sleeping, tendency to develop high fever, and irritability. So Western diagnosis, there is acne vulgaris. Background to disease, abuse of nicotine, black tea, and cannabis. There's also a regular lifestyle and frequent viral and bacterial infection with high fever. Next case is a female, 58 years old. The tongue is pale red, very swollen. So there is underlying kidney yang deficiency, accumulation of dampness in the middle and upper burner. There's also a swollen, dry, and crack in the anterior third and center of the tongue. So there is a blockage of lung qi due to accumulation of dampness and blockage of water pathways. So onset of lung yin deficiency. So symptoms, there is a frequent cold with cough, shortness of breath, swollen lower legs, dizziness, intense inner feeling of cold. So Western diagnosis, there is edema of the lower leg, chronic bronchitis. Background to disease, for years, her work required that she stand and overwork, okay? So next case, we have a female, 28 years old. The tongue is pale red and pale edges. So there is a presence of spleen qi deficiency with blood deficiency. There is a deep horizontal crack in the center and anterior third. So this is a stomach and lung yin deficiency. There's also a slight swelling in the anterior third. So retention of phlegm in the lungs, red in the anterior third. So there is a heat in the upper burner and the tongue is dry. So there is a deficiency of fluids. Patient symptom is chronic cough with profuse, white, and slightly yellow mucus. There's a nasal congestion, dry throat, exhaustion, and mood swings. So Western diagnosis, there is a chronic sinusitis, chronic bronchitis, and sa background to disease, repressed emotions, excessive consumption of spicy foods. Next patient is a male, 35 years old. The tongue is pale red and thin. So there's a spleen qi deficiency with slight blood deficiency. There is also small irregular cracks in the anterior third. So there's an onset of lung yin deficiency. There's also a yellow dry coating without root in the posterior third. There's onset of kidney yin deficiency with retention of damp heat. Sa patient symptoms, there is chronic cough, dry mouth, thirst, inability to fall asleep. So Western diagnosis, there is a chronic bronchitis, And sa background to disease, cigarette smoking for many years and irregular lifestyle. Next case is a female, 38 years old. There's a reddish rough tongue surface. There is an onset of kidney Yin deficiency. There's also a red edges, meaning there is heat in the liver, and deep irregular cracks in the anterior third. So there's a lung Yin deficiency and deep red spots at the tip. So there's a long-standing retention of toxic heat and yellow thick greasy coating, especially at the root. So there's accumulation of damp heat in the lower burner. Patient symptoms is difficulty in breathing, there's dry mouth, thirst, night sweat, restlessness, tendency to catch colds. And sa Western diagnosis, there is a chronic tonsillitis with abscess of the crypts, allergic rhinitis, bronchial asthma. So background to disease, repressed emotion, especially grief and feeling of guilt due to having given birth to a handicapped child. Family history of respiratory diseases. So sa case history, Mrs. L, 38 years old, appeared exhausted. She looked after her physical and mentally handicapped child night and day. Her marriage had become strained because she spent too little time with her husband. Sadness, feeling of guilt, and deep-seated anger over her circumstances determined her emotional life. For months, she suffered from restlessness and night sweats. After any emotional stress or physical exertion, she felt a tightness in the chest and occasionally experienced difficult breathing. She was susceptible to colds and suffered from frequent tonsillitis. She was therefore unable to cope with the task of her life. The tongue coating was yellow and greasy, especially in the posterior third. The deep irregular and vertical cracks in the anterior third of the tongue was particularly noteworthy. The tip of the tongue showed dark red spots, and the edges of the tongue were red. The pulse was rapid and wiry. Sa analysis, Mrs. L's unresolved emotion caused liver qi constraint, which led to heat in the liver. This is manifested in the tongue's red edges and the wiry quality of the pulse. Her long-standing sadness had injured both the lung qi and yin, which occasionally led to the asthmatic attacks. The tongue reflects both these pathologies quite clearly. The red edges shows liver heat, while the deep vertical crack in the anterior third of the tongue indicates lung yin deficiency. The lung qi and yin deficiency contributed to her tendency to catch colds, which were characterized by sore throats and inflamed swollen tonsils. The dark red points at the tip of the tongue reflect the presence of toxic heat, which was retained in chronically inflamed tonsils. The underlying kidney Yin deficiency gave rise to heat, which in this case manifested as night sweats, while the heat in the liver contributed to the accumulation of heat in the interior. This heat depleted the fluids, resulting in a dry mouth and intense thirst. The greasy yellow coating in the posterior third of the tongue reflects the presence of damp heat in the lower burner, which has not yet caused any corresponding symptoms in the patient. Sa discussion, lung Yin deficiency will always lead to dryness and or heat from deficiency. As a rule, this will be reflected in changes in the anterior third of the tongue, redness, dryness, and the formation of cracks. The appearance of any of these tongue signs should be a signal to abstain from eating spicy, hot foods and herbs, and more importantly, from smoking. All of these activities will have a drying and heating effect on the body. So, another case of a female 51 years old, the tongue is pale red, slightly swollen. So, there's a slight spleen qi deficiency, accumulation of dampness. There's also a small horizontal cracks over the entire tongue. So, there's a stomach Yin deficiency. There's also a deep irregular crack in the anterior third, so presence of lung yin deficiency. The symptoms is chronic cough with sticky yellow mucus. There's an intense thirst and constipation. So Western diagnosis, chronic bronchitis and background to disease, dusty working conditions, excessive consumption of dairy foods. Next patient is a male 71 years old. The tongue is deep red. So there's a presence of kidney deficiency with lack of fluids, contracted, red, dry, peeled in the anterior third. So there is a presence of lung yin deficiency. Symptoms, cough with blood-tinged sputum, pain in the chest, dry throat and mouth, night sweats, exhaustion. Sa Western diagnosis, there is a bronchial cancer. Sa background to disease, smoking for 50 years. Thank you for your attention.